Good morning, everyone. I'd like to welcome you to today's webinar on orders with insurance, or what we call at NDE insurance on the fly. So this is going to be applying insurance benefits to a patient without a fee schedule. The first thing we would want to do, this would be the workflow, would be to pull up your patient. Now, if the patient was examined in the office, you will go to the Vision RX tab to see what the doctor has prescribed. Next, you would go to the Insurance tab and verify that insurance has been attached to the patient, and this is what we mean by that, selecting insurance. If there was a secondary insurance to add, this is our Vision Primary, our Gain Insight plan, or our Gain Insight Insurance and plan. We will pull through our social. If there was a group number, we would enter that here. If the patient had a secondary insurance, we would click Add here. It'll update to Vision Secondary. I can, however, change this to medical if it's a medical. And then again, I can pull in my insurance and my plan. I can pull the social from the first page of the profile by clicking this button. If your insurance ID is different, however, you will enter that information in. And then, of course, a group number here. We also want to designate the insured party here. So it's going to default to self. Now, if the insured party is not self, if it's a guarantor, we can click the guarantor radio button, and it'll pull the guarantor information from the demographics tab. If the insured party is a patient in our office, we'll click the patient radio button and we'll search for that patient here, and we can pull that information in. Show you how that works. And it'll bring that information into the screen for you already. No double entry. You also have a notes field here. We'll go ahead and leave insured party as self. So now we're ready to create the order. So we'll start with the Vision RX tab. We'll select the prescription that we're going to use. We'll click Order from RX. Now we're in the order with all the patient information selected, and the prescription is already here. So I don't have to go back out to the profile, and I don't have to go back out for the prescription. Because the patient was examined in the office, the diagnosis codes are going to come through here automatically for me. I don't have to worry about that. I'm going to bring a frame into this order. So I'm going to come here and click this ellipsis button, and I can filter by manufacturer, and I can even break it down by collection. Actually, let's pick down here and select. All right. It's going to default to both eyes here, but I can update that if I need to. And we'll send a frame to come to the lab. My PD is already here. I'm going to select my lenses, and I am going through the order part of this rather quickly. If anyone has any question about that, though, I'm certainly able to slow it down and go over anything that you may need. Just send me questions, and I'd be happy to answer them for you. We'll go ahead and select single vision. I can filter it down even more here by material and select my lenses. Either double click and highlight or select. Pick the stock lens. Actually, let's pick up right that's not a drill mount, sorry. For our purposes here. All right. Very good. Once my lenses are selected, my options will come in. So I'm also going to select an AR coding for this order. All right. Now, services are available here. So if for some reason your doctor's not using the exam module in My Vision Express, but you still need to bill for an exam. Where you're going to come is right here to the services button. And this is going to give you a list of all the services that are available to bill for. Now for this example, we're going to, this patient was examined in the office and our doctor uses the exam module. So to bring exam charges in, I'm going to come over here to the exam button and I'm going to click that. And when I click that, I'm going to see the date of exam here. I'm going to see the diagnosis code here. And then I'm going to see what's available to bill for. And both of these came in highlighted. If for some reason I wasn't going to bill for one of those, I can unselect those items. I can select all or select the unbilled. I want to bill for the refraction and for the exam. So I'm going to go ahead and click OK. Now you know you've done that when the exam number shows up underneath the exam button. That means you have linked this exam to this order and the charges came in down here. Now this is also the trigger for the pre-appointment if you happen to be using that and wondering how that comes about. Once this exam is billed, if you're set up for pre-appointment, the system will schedule that appointment and it will print on the patient's receipt. At this point, I just want to check and see if we have any questions here. No, I'm not using Skype. Is the sound any better? So that's one thing I haven't had any issues with. So let me know. All right, I'm going to continue on. All right, so our lab is selected. We go ahead and put in our promise date. Our status is here, sold by and fitted by are going to autofill. Once your order is complete, that's when you want to pull in your insurance company. So I'm going to come here to this first drop down, and I'm going to select this patient's primary insurance. I'm going to come to the next field, and I'm going to pull in the plan. Now, I haven't entered an authorization. If there was an authorization, you would click here and pull the authorization in. Again, we're doing what's called insurance on the fly. So I'm going to build this completely at the order level. And what we mean by the order level is on an order. So the first thing I want to do is I want to open up the frame line. And I can double click it or highlight it as it is right now and click modify. And that opens up my modify window. We've got our procedure code, our frame, and our frame charge. So the first thing we want to do is we want to put in the frame allowance in the retail allowance box here. So let's say there's a $120 frame allowance on this frame. I'm going to enter 120 and I'm going to click anywhere off of that field. It's going to put that 120 also in the insurance pays field. Now also, it'll put the balance of that in the patient pays field. Now let's say this patient gets a discount in addition to their allowance. So if I come to this field right here and I click it, it's actually a drop down. And I can discount by amount, percent, or retail amount. I'm going to select percent. And in this discount field right here, I'm going to enter the amount of the percent. So 20%, when I click off that field, it will calculate the discount and subtract it from the patient pays. So for $199, insurance is paying $120 and the patient is paying $63.20. I'm going to go ahead and click OK. That's going to bring it forward to my order here. I can see everything in that window by scrolling across. So there's the discount, there's the full amount. Next, I'm going to go to my lenses. Now, if you notice, lenses are split right and left. So I again want to open this line. and I can double click, or I could have highlighted and clicked modify here. So here we're going to go ahead, we can break this down by procedure. Let me back up 1 second. 1 second on the frame, so sorry. So let's say, did the patient have a copay on this frame? If the patient had a copay, and let's say that they did, we would come here and we would enter the copay in the copay field. Again, I'm going to click anywhere off that field, and it's going to subtract the $15 from the insurance pays. Okay? I'm going to see if there are any questions. I hope I didn't confuse anyone. Yes, I will be showing contact lens orders. Yes, I will. So this first order, let's open this back up. $199 for the frame. Retail allowance is $120 and a $15 copay. So the allowance minus the copay is what the insurance pays. The patient also got a 20% discount off of the overage, and that's shown here, and here's the patient pays. We'll go to lenses now, which are split right and left. So I'm going to highlight the right lens. I can double click that or click modify, and it's going to break my items down by procedure code. So I'll come here and I'm going to enter what insurance pays. So for the single vision portion of the lens is $30, and the insurance is going to pay that. The additional cost is the polycarbonate. If the insurance pays that, I'm going to enter it. If the insurance does not, I'm going to leave it as it is. We'll go ahead and say insurance is covering the polycarbonate. Now, if there's a copay, we're also going to go ahead and enter that in this field. And let's say that there's a $20 total copay for lenses. Now, because these lenses are split right and left, as long as you check this box right here, right equals left, any calculation you do on the right eye will be duplicated on the left eye, so you don't have to do it twice. The only thing you need to be aware of is you need to split your copay in half. So if the total copay for lenses was $20, I'm only going to enter 10 here. I'm going to go ahead and click OK. And it's going to copy that exactly to the left eye. So copay 10 and 10, there's my 20. Insurance is covering 40 of that. Excuse me. Everything that you could see in the box, you can see out here on the line. And I'm going to see if there are any questions on this so far. Okay, looks like we're looking good so far. Oops, I accidentally entered 2 AR codings here, so I'm going to highlight and delete the one that I do not want. It's just asking me to verify that's what I want to do. I'm going to say okay to that. And now we're on our AR coding line. So highlight and modify or double click. Now it's also splitting up by procedure code here, so the coding and the UV. If the insurance doesn't cover anything towards this, then you'll just go ahead and click OK here. If the patient does get a discount on the AR coding, you'll come here. Now, if you notice, you don't have the percent on coatings and lenses. If there is some type of discount, you have to do it by amount, so you'll have to calculate that yourself. So let's say there's a 20% discount on the coating here. I would select amount, and I'm going to put in $18 here. And if I click anywhere off that field, oops, it's going to subtract that for me here. So it's subtracting the 18 from the 90. AR coding, we're going to leave that as it is. If there was a discount, you would again select amount, and it would be a $2 discount if it was a 20%. All right, I'm going to go ahead and click OK here. and that's in the patient field. Now the next tab is refractive tab. We'll go ahead and or charge for refraction. If the insurance pays it, you're going to enter it here in the insurance pays column. If the patient pays it, you'll leave it as it is. Insurance pays it, we'll go ahead and enter it here and click OK. The next charge is for the exam. We're going to open up that line. And again, we're going to enter what the insurance pays. Now, if there's a copay, we don't need to split anything here. So let's say there's a $20 copay on the exam. I'm going to go to the copay column. I'm going to enter the copay amount, and I'm going to click off of that field. And it's going to subtract the copay from the insurance pays. Okay? I'm going to come here and click OK. So these are the copays totaled up. This is the patient's portion totaled up. And then the patient total is the copay plus the patient amount. Then we have the total insurance amount, item total, retail amount, discounts are listed here. Okay, so everything in that window you can see if you just scroll over to the right. Now at this point our order has not been saved, so I actually have to save it. Once I have an order number, I know I'm good. All right. I'm going to go ahead and open this up and see if we have any questions here. Let's see. Yes, Todd, I am recording this video, and I can send it to you or make it available to you for sure. Okay, so no questions it seems like about this order, so let's just review it a little bit. I'm going to do a couple different ones as well. So as you can see here, this diagnosis code, if the patient is examined in your office, the one thing I want to make sure that you know is if the patient was not examined in your office but is still using insurance benefits, you'll need to bring this code in manually. And to do that, you'll click this ellipsis button and it'll give you your list here. You can still search by ICD-9 codes if you need to, and it'll filter appropriately for you, okay? So that was one thing I want to make sure that we covered. So let's move on to another order here. I'm going to go ahead and close this because we've saved it. And let's see, I have another patient that we can use here. Highlight and select that patient. I'm going to go to the insurance tab. I'm going to make sure insurance is selected, the vision primary, the insurance company, and the plan. I'm going to click this to pull the social from the patient's profile. This patient did not have a social entered in. I could have just entered it there, but for everything to work, it's best to enter it here within the system, especially if you're using a clearinghouse and you're e-filing claims. You want to make sure that this is the place that you enter the social, and then when you get to the insurance tab here, that you pull it through, okay? If there's a group number, you're going to enter it here, and you're going to note the insured party. Okay, now you do have an option if there was an authorization number with the insurance company that you're using. If you click this authorizations tab right here and come here and click add, you would enter your authorization number here, and you would authorize what you are, or you would enter what you've authorized benefits for. So here we could say exam and contact lenses. All right. If you're working with allowances and copays, you can enter them here. So I'm going to come here and I'm going to say, okay, I've got a $120 allowance on contacts, and and a copay, a $15 copay, and for the exam, there's a $30 copay. All right. I'm going to go ahead and save up here. I'm going to go to the Vision RX tab to see what the doctor's prescribed. And we don't have a contact lens prescription here. Let me quickly add one. Sorry about that. I thought I had one in here prior to this webinar. Sorry, I'm going to select a prescription here. All right, and click OK. This is where you would come to see what the doctor had prescribed here. So I'm going to go ahead and, okay. I'm going to go ahead and select the prescription that I'm going to use here. And I'm going to click Order from RX. And that was just asking you where the inventory for the contact lenses are coming from. And when I get to this order, we can see that it pulled my prescription in here. So I don't need to do anything more there. The replacement schedule also came through. We're going to order these contacts. If I needed to adjust the quantity, I can easily do that here. All right. Contacts are pretty short and sweet. So once I have my items here, lenses here, again, if the patient is not examined in your office, you'll be able to go through the services here and you'll be able to select what you're billing for. If you had anything miscellaneous to bill, any kind of cases or supplies, you could select that here. To pull the exam in, it's exactly the same as on a spectacle lens order. So if the patient was examined in the office, you'll come here to the exam button. And you will have the date and exam number. You'll have your charges come through here. And you'll go ahead and you can select or unselect and go ahead and click OK. Once you do that, it's going to bring in your charges here, and it's going to link your exam number here, just exactly the same as on the spectacle lens order. You'll want to come down and select your lab and your promise date. We've got a status of open here. All right. So once our order is complete, we're going to pull in our insurance company, our plan, our authorization number, because we entered one here. All right. Now, once I brought in that authorization, it pulled in automatically the information that I entered here under the Details tab. I mean, the Details tab is your shortcut to the patient profile, so you can get to the Insurance tab. Remember, I came here and I entered a $120 contact lens allowance, a $30 exam copay, and a $15 contact lens copay. All right, so that brought that in here, my contact lens allowance, my contact lens copay, and my exam copay. Now, to see that, you don't technically have to go back here to the Details button, but that is a shortcut. If you come down here to the More button, and I'm going to go ahead and click that, I can see what I entered in under the Insurance tab. So I can see that I authorized for exam and contact lenses. I have the allowance amount right here. I have the exam copay right here, and I have the contact lens copay right here. Now, let's say that for some reason, if that information wasn't correct, maybe the patient has a $150 allowance amount. You can change that here, all right? You, whatever you do right here and right here is the final say. All right. So if you needed to adjust anything, you could go ahead and do that right here. And you can see it updated immediately. So in this particular case, I don't need to open up my contact lens line, neither one of them, because it's subtracting my contact lens allowance from these two lines. All right. My copay comes on a separate line. My exam charge or copay comes on a separate line. Here, we do still have to open this up though. If the insurance is paying the refraction, we would enter it in the insurance pays. If the patient is paying it, we would leave it as is. For the exam charge, if this total amount is covered by insurance minus the copay, we'll go ahead and enter that right here. We're not going to subtract that copay from here. That's happening already. All right. No, actually, that's wrong. We will enter the copay. I'm sorry. The insurance pays at $90. Sorry about that. We'll go ahead and click OK here. I'm going to see if there's any questions about this because it seems like it should be more complicated than it is. I know, but it's not. Okay, Todd has another question about the video. I will not be able to convert that video until after it is completed and saved. So if you send me your email address, I'd be more than happy to send it to you, Todd. All right, very good. Any other questions that you have on this? All right, again, I don't have an order number here until I save it. So once I save it, I have my order number. And I can go ahead and check this patient out. Our patient was examined in office, so here's our diagnosis codes. All right. I'm going to go ahead and let's go ahead and do an order, and then I'll do contacts without an exam, just if a patient came in. So I'm going to go ahead and close this order. I'm going to check one more time for any questions. All right, hold on. Yep, we have a couple. Do you need an authorization number for the calculations? No, you don't. Actually, I'm going to show you how to do that right now. If you make changes under the More tab, does it change under the patient profile? It will update it in the patient profile as well. Yes, it will. Very good questions. Okay, I'll check again for questions too. All right. So let's do this. I'm going to show you how to add to your information to the More button without entering it under the Authorizations tab, because you can do it that way as well. So let's go ahead and I'll use, let me see what patients we have here. Let's go ahead and select this patient, and patient comes in. We're going to check their insurance. We want to use their primary vision. I'm going to go to the Vision RX tab, and I'm going to select their contact lenses. And I'm going to come here and I'm going to select Order from RX. Okay. Now when I get to the order screen, patient information is all filled in here. My prescription is all filled in here. My quantity is good. I can leave it the way it is, or I can update this if I need to. Okay. The patient was not examined in the office today, but they are using their insurance for contact lenses. I'm going to come here for diagnosis, and I can select my procedure code, I'm sorry, diagnosis code, and enter that in. My charges are already here, right and left, so I don't need to come here, all right? I do want, if my order is complete and I don't have any miscellaneous, maybe if you have shipping charges, maybe you're shipping them to the patient, so you'll select shipping charges. And then you'll come here and you'll select the ship to. And we can, maybe we're shipping to the patient's home. We're going to select that. We're going to select the insurance or the shipping method here, and we're going to go ahead and close. All right. Our order is complete. Now we want to apply the benefit. So we're going to pull in the insurance, primary, and we're going to pull in the plan, right? And we're going to come down here to the More button, okay? And I'm going to say, all right, I authorize this patient for contact lenses. This is the amount that they have, say $150, and they have a $30 copay, all right? You'll select what applies here, and we're going to go ahead and click OK. And it brings that in automatically. It brings in my contact lens allowance. And I don't see my copay here. Let's open that back up. Here's my copay. Let's go ahead and refresh this. Allowance type. Let's see if that, there we go. Allowance type, this is a drop down, sorry about that. You can specify if it goes toward exam, or I'm sorry, contacts only, exam, fitting, and contacts, or just the fitting and the contacts. So I brought in that it's for contacts only, and it displays my contact lens copay here, my allowance here. And that's all there is to it. Pretty short and sweet. Now you can also use this for spectacle lenses. And when you have a spectacle lens order, a frame only order, you can also, if we were on a spectacle lens order, it would show those. And I'll go through that today too. All right, I want to see if we have any questions here. Good questions today. If you make changes under the More tab, does it change? Yes, it does. Under the Vision RX tab, what is the difference? What is the difference between order from RX, spectacle lens order, and contact order? Great question. All right, let me close this order and let's go back into the profile. All right, yes, I want to save the change. Oops, yep, there's my order number. It's now been saved. And let's go back into the profile here. And I'm going to select my spectacle lens order, or spectacle lens prescription. Now, all these buttons down here, order from RX, all the way down here, they all kind of do the same thing. When I select the prescription that I'm going to use, and I click order from RX, it's going to take me to an order screen, and it's going to open up the order type based on the prescription type. All right. Down here, you're telling the system specifically what type of order to open. So frame only order, your other order type would be an exam only order. And then you have spectacle lens, soft contact lens, and hard contact lens. Neither way is right or wrong. It's a habit for me to use order from RX. You just can't go wrong with that one. So, I mean, unless it was an exam only or a frame only order. So I hope that answers your question. Let me know if you have any more. So let's go ahead and do this order completely on the fly as well. So we're going to select our prescription here and click order from RX. Again, this patient, it's picking up our previous exam diagnosis here because we just did one, a spectacle lens order. And it may do that for you too if the patient wasn't examined. Just make sure that it's the right diagnosis code here if the patient is using insurance, okay? We're going to come to the UPC field and we're going to select a frame and highlight and select or double click. And here, this will default to both eyes. If you're only doing one eye, you can change that. I'm going to send my frame complete frame to come to the lab. My PD auto-filled from the Vision RX tab, so I don't have to enter that. I can come here, select my lens style, and I can select my material. Okay. Once I select my material, my options come in. All right, so I can expand these categories to make a selection, and I can select my coating. If you had drill charges, groove charges, scratch coating, slab off, any of these additions, you would go ahead and select that. Any miscellaneous items you could add here as well at this time. So I'll come here and select my promise date. My status is open. My order is complete. If I wanted to, by the way, if I wanted to specify a bevel here, I could do that as well as the usage. So if I was fitting more than one pair, you may want to note the differences here. All right, so now that my order is complete, I'm going to come here, I'm going to select my insurance company, I'm going to select my plan. All right, now the way we did it before, we could open up each individual line if we wanted to and calculate it out. Now this will help a little bit, but it's not going to do everything like it does with contacts because it's a little more simple. But so if you had authorized for frame and for lenses, you could note that here. And if there was a material allowance, you could enter that here, a total allowance. If there's a copay on frame, you know, you can separate all of this out. It's the same information. It's the same fields that would be available to you. So if we went details and we went insurance tab and we came down here to authorizations and we click add here, we could note frame and lenses, so on and so forth. Now this particular plan that we're on has a fee schedule attached. We're not talking about that today, so I'm going to go back out of this. We're talking about insurance on the fly. This is pulling up our old. So see, it's highlighted here, so I'm going to click add to clear that out. And here, I could come here and say, for instance, spectacle lenses. Now, we haven't added that yet, so, but that's where it's communicating from, all right? Details to the Vision RX tab. So when I come here to more, we've got our frame, frame and our lenses, and we can add our frame copay, say $15, and our lens copay at $30, and we can go ahead and close this. All right. And this is picking up part of that fee schedule, by the way. That's where the dispensing charges are coming in. We're not working with that today, so I'm going to go ahead and delete this line for a moment. All right, so it brought in our lens copay. We still want to open up this frame line, and we're going to come here. Our frame is $250. We're going to enter our allowance here. Let's say we have a $150 frame allowance. And let's say this patient gets a 20% discount. So we're going to calculate that 20% here. Puts the rest in the patient pays. The charge, $250. Retail allowance, that's what the insurance pays. 20% discount, select percent, add your 20, calculates the discount, and subtracts it from the patient pay. Okay? All right. Let's see. For lenses, we're going to open up our lenses. We won't apply the copay here. We're going to go ahead and enter what the insurance pays here. So the insurance pays the base cost, and the overage is to the patient for the 160. We'll go ahead and leave that just as it is. And whatever we calculated on the right eye will be duplicated on the left eye as long as this box is checked. All right, and I'm going to go ahead and click OK. Now for the coding here, open up that line. If the insurance pays any part of this, we're going to enter it in the insurance pays. If this patient gets a discount on this coding, remember, for lenses and coding, we don't get the percent option. We have to enter an amount. So this would be $18. We're going to go ahead, we're going to go ahead and enter in the $18. It's going to subtract that from the patient pays. And we're going to click OK here. All right. Let's see if we have any questions. Let's see here. Generally, we always have our staff choose the insurance before they put other data in so they don't forget to do it. Does it make a difference if they choose insurance before or after the items in an order? Well, to be honest with you, with insurance on the fly, you can do it before or after. I try to keep that workflow because if you're working with fee schedules on the back end, it makes a difference. So honestly, no, they can pull it in first if you're using this method. If you are using insurance on the fly and calculating everything up front here, then yeah, it's okay. But again, if you're using fee schedules, do it at the end. So that's the reason why I demonstrate it that way. And I hope that answered your question. Let's see if we have any more, how everybody else is doing. Let's see, I want to make sure I didn't miss any questions. All right, I think we're good. I'm going to go ahead and let's go ahead and we'll do one more. I'm going to go ahead and save this order so I get my order number. All right. And we'll go ahead and do this completely on the fly. We won't use that more button. We'll just do another one straight away. And I'll go ahead and use Wilma Flintstone again. So I'm going to come to my insurance tab. I have my vision, primary, my company, my plan, my social. I would enter a group number, my insured party. I would go to the Vision RX tab to select the patient's prescription. All right. So I can select, she's got 2 on file. The reason she has 2 on file is because one is labeled computer. So you can do that. All right, I'm going to highlight the prescription that I'm going to use because you can finalize more than one here. I'm going to use the spectacle lens prescription. My preference to select order from RX, but I could also select spectacle lens order. All right. Now when I'm to the order, I've got my patient information here. My diagnosis came in because the patient was examined in the office. I would do this manually if the patient wasn't. All right. I'm going to come to this ellipsis button and I'm going to select my frame and select. Okay. Both eyes, it will default to. I can change that if I need to. Finishing center, maybe I'm doing lenses only. Complete frame to come. Or maybe I'm only sending a front. We're doing complete frame to come. Now if you notice, I selected a multifocal prescription. So the PD was entered in on that Vision RX tab, which is why it hasn't highlighted in red because it auto-filled from the Vision RX tab. Now, if that didn't happen, your PDs would have highlighted in red as well. Because this prescription has an ad with it, that's why the spectacle or the seg height field is highlighted in red. The system recognizes that that has to be filled. Now, I don't know if you've ever worked with this button, but let's say this patient decides to go with reading only and you didn't convert that. You can do that on this screen. Just be aware, once you do it, you can't undo it. So you'd have to pull in the prescription again. So once I select the reading button, it's going to calculate this to a near reading only for me. All right. And then in this case, I will probably select reading here. Okay. Then I'm going to come here to the ellipsis button and I'm going to select single vision and I'll filter here, polycarbonate, and I'm going to make my selection, pulls my lenses in. Once my lenses are in, my options come in, select my AR coding, my promise date. My status is already open here, sold and fitted by. We're going to pull in our insurance plan and our insurance company, I'm sorry, and now our plan. In this case, there's no authorization. We're not going to enter anything under the More button, and I really only recommend that for your allowances and your copays. Don't try and do much more than that with it unless you have fee schedules entered in. So again, to open this line, I can double click it. All right. The charge is here. I'm going to come here to the retail allowance and I'm going to say I have a $120 frame allowance. All right. I'm going to come here and say the patient gets a discount. So we could say a 15% discount here. It'll calculate it and subtract it from the patient pays. All right. If there's a copay on the frame, I'm going to come here. So you've got a $15 copay. Oops, not 150, a $15 copay here. It's going to subtract that from the insurance pays. And I'm going to click OK. Lenses, split, right and left. Open this line. And our single vision portion of the lens be 2103. We can enter what the insurance pays. And then the cost of the polycarbonate, probably depending on the age of the patient. Say the insurance pays. Now, if there's a copay, remember, we're splitting those right and left lens. So if there was a $25 copay, we would have $12.50 here. All right. And click OK. As long as right equals left is checked, it's going to apply it to both lenses. And there we go. Okay. AR coding here. If the insurance covers any of that, or maybe according to insurance, patient is only supposed to pay $75. We're going to enter that in the patient pays. And remove that from the insurance pays. Okay? And we're going to click OK here. The next step would be also the payment button will save your order. So if you're going to go to checkout right now, you could just click payments and it would give you an order number as well. Okay? I want to see if we have any questions here. Let's see. Let me scroll through here. Why is there no percentage on lens treatments or coatings? It has to do with what you're allowed to do. Lenses aren't supposed to be discounted, which is why they don't list a percent there. It used to be that way, but for how insurance is calculated, it was removed. So that's the best answer I have for you. Any other questions? Anybody want me to go over anything again? Okay. I hope this helped you. I try to really simplify it for you if I can, because insurances can be so complicated. And I try to just keep it simple, especially when you're new. Let me know if there are any. Oh, when do we plan on doing insurance with fee schedules? You know, I'm not sure, but now that I have a request for it, I'll let them know and see if they can work it in on the next webinar schedule. I think we're scheduled out till January 22nd right now. So it'll probably be after that, but sometimes they add webinars to the schedule. So check it frequently. I mean, I would check it at least once a week and see if they've added anything to it. But I will let them know that there's a request for fee schedules. All right. Anything else that I can help anybody with? Or any questions about what we did today? Okay, anything? I'm going to leave it open for a couple minutes just to see here if there are any further, if anything comes up. Any questions? All right. Well, I'd like to thank you for attending today's webinar on insurance on the fly. I hope you learned something new today. And again, send me your email if you would like a copy of this video, or let me know and I'll send it to you. Todd, I've already got you though. Thanks everyone for attending, and I hope you have a wonderful day.